I'll be sharing time, Lescian Corla, with Deputies Brown, Brazel, Butler and Cowan.
10 minutes.
Thank you.
The clock.
Lescian Corla, patients in Ireland now wait longer to see doctors and to get treatment than patients in any other European country. Waiting times for cervical check have jumped from 2 weeks to 6 months. Mental health services are in crisis and chronically underfunded. We have about half the number of consultants that we need. The costs of the National Children's Hospital have exploded, threatening other healthcare projects for years to come. In this context, our healthcare professionals are at their wits' end. Hundreds of GPs took to the streets outside Leinster House yesterday to protest the asset stripping of general practice. Consultant posts lie vacant around the country. The ambulance drivers are taking strike action. The psychiatric nurses are taking strike action. And the focus of this morning's session, the nurses and midwives have just commenced their 3rd day of national strike action, only the 2nd such action in 100 years of INMO history. They have been calling for meaningful engagement for 5 years. They want to discuss conditions, staffing levels, patient safety, cost-saving opportunities, career progression, and one of the core issues of this strike, the inequitable situation where a newly minted honours degree educated nurse walks in the front door of a hospital on their first day of work with an allied health professional and the nurse earns €6,000 to €7,000 less. The government's response to date: they will meet with the INMO so long as the issue at the centre of this strike is not discussed. But worse, the government didn't even have the courtesy to tell the INMO of their offer directly. Rather, they issued that offer via press release. If anything, Lescian Corla, that action, that lack of respect, has further galvanised the tens of thousands of men and women on picket lines this morning. The government maintains that there is no blank cheque. They're not looking for a blank cheque. They're looking for real, respectful, open engagement. The government maintains that they can't engage on issues of pay because of the public sector pay agreement. That agreement allows for these issues to be dealt with where recruitment and retention has been identified as a problem. The number of mental health nurses is falling. The number of community nurses is falling. Many hospitals around Ireland are struggling to hire staff nurses and have particular issues in specialties such as intensive care and emergency medicine. That provides the space for an urgent review for nurses and midwives within the parameter of the public sector pay agreement. The General Secretary of ICTU has stated that she believes the INMO issues can be addressed within the parameters of the public sector pay agreement. We all know that these issues are going to be resolved sooner or later. The question is, Lescian Corla, how much pain is this government willing to inflict on patients, on their families and on healthcare professionals? Not a single nurse or midwife wants to be on strike today. They're on the picket lines because they haven't been listened to, because they're not being respected. This government now has a few critical days to get on top of this situation and avert strike action next week. Our hope is that they will start taking their responsibilities seriously. Thank you.